Hello, good day, welcome to my channel. If this is your first time coming to my channel, please hit the subscription button and give me a thumbs up. Today, I just want to talk about how to get into residency training in Australia. I already did a video on how to immigrate to Australia as a doctor, and some of my viewers have asked me to do a video on how to get into residency training. So to get into residency training, it's pretty straightforward in Australia. Personally, I'm a psychiatry registrar. So I'll speak from my specialty and I'll talk about other specialties as well. So generally, if you want to get into residency training, it is advisable to work as an unaccredited registrar, what is called a principal house officer in that specialty that you want to get into the training. For example, I wanted to do psychiatry training, so I worked as a psychiatry principal house officer for 6 months, and then I applied to get into the psychiatry college. So the way it works, you need to have a job in that department that you want to do your training. For me, I had to get a job in the Department of Psychiatry in a hospital. So whilst I was doing that job as a principal house officer, which is essentially an unaccredited registrar, then I applied to the college, the Royal Australian and New Zealand College of Psychiatrists, to become a trainee. So for you to be accepted, you need to have a job already in the department that you want to do your training. So I worked as a principal house officer for 6 months and then applied to the college. So I was accepted into the college because I already had a position, a job in a hospital. So if you want to do training in internal medicine, for example, you need to get a job. It is advisable to get a job as a principal house officer, which is an unaccredited registrar in a hospital in the internal medicine department. And then while you're doing your internal medicine job as an unaccredited registrar, then you apply to the Royal Australian College of Physicians to become a basic physician trainee. And then you get accepted into the college and you start your training officially from the hospital that you're already working as a principal house officer. Now, for some other specialties, it's more competitive to get into the training. For example, orthopedics, ophthalmology, and some of the surgical specialties, they are more competitive than some other specialties. So, for example, I know of a doctor, he worked as a principal house officer in orthopedics for 5 years before he was accepted into the college, the orthopedics college, to train as a trainee. And then, he went on to do his training for 5 more years to become a fellow. In some other specialties, like the surgical specialties especially, some people go as far as doing a master's degree, in order to improve their chances of being accepted into the college because it's very competitive, you see. So, just to recap, you get a job as a principal house officer in the specialty that you're interested in. And while you're working as a principal house officer, which is more like an unaccredited registrar, then you apply to the college that you want to train. So there is no set time for most of the colleges to apply. Or rather, most of the colleges accept people into their training on twice a year, but it's not like a general application that has a set time of the year for all the colleges. No, each college is different to another one. So you have to contact the respective college that you're interested in applying to their training program and find out when their application is going to occur. And then you gather all your documents and then you apply. It's unlike the US that they have a central matching system. It's different. So to improve your chances of getting into residency, the more number of years of experience you have in that department, the higher chances of being accepted into their training program. Okay, so Yeah, so it's pretty straightforward, and that's it. So if you've got any questions, put it in the comments below. I'll attempt to answer the questions. And if there are any more videos you want me to do regarding working as a doctor in Australia, put it in the comments below, and I'll try to attend to them. Thank you for watching. Please subscribe, give me a thumbs up, and share the video. See ya!